Look at that.
On this episode...
Oh, whoa.
That's the stomach.
That's it there. It's like a rock.
What's Teddy eaten that's landed him in emergency?
I'm not surprised. I've seen dogs eat a lot of crazy things.
That's not going to be easy to cut out of the stomach.
She's got a bit of an embarrassing problem.
Biggie the Chihuahua needs urgent surgery.
In this case, we're going to have to do a fishing expedition.
Oh no.
The infection just isn't improving on the toe.
And the Shens meet Misty, a tiny battler.
If anything, that's actually looking more swollen and more infected.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Oh, whoa. That's it there. It's like a rock.
On the Gold Coast, Gerardo's patient Teddy is fighting for life after eating something quite bizarre. And Gerardo needs to call in reinforcements for emergency surgery.
Hey, Trooper.
Hey, what's up?
Hey, I need you to come here as quick as you can.
What's going on?
We have a dog here that ate Gorilla Glue,
What is Gorilla Glue?
It is a super strong adhesive.
and it's formed a big ball in its stomach, and it's huge.
I will be there shortly. See you soon.
Check out the X-ray. This is scarily impressive.
Look at that.
That's what we're looking at here.
The X-ray shows a dilated stomach that's full of the glue. It's quite shocking. It looks like it's formed a ball in there. So you'd really hope that if we could go in there, it may just come out as a ball, but my worry would be that if it's actually stuck to the stomach lining, that we may have to resect part of the stomach itself. I've never seen this before, but I'm not surprised. I've seen dogs eat a lot of crazy things.
That's a 10 by 12 centimetre ball. That's not going to be easy to cut out of the stomach.
There's a number of things I'm concerned about today. There's the obvious gut obstruction, but there's also a chance that this glue may have perforated the stomach. If Teddy's stomach is perforated, then he would be in a world of trouble. We'd be dealing with a very complex surgery and also an overwhelming infection.
Here he is.
Oh wow, he's already ready to go.
Yeah, the team have got him ready to go. It's clipping his belly at the moment. Hey.
The patient today is Teddy. Teddy is a beautiful groodle.
He is cute like a teddy bear, isn't he?
What were you thinking? What were you thinking, you silly boy?
Probably thought it was like a tube of like caramel or something like that.
I can imagine it tasted very good. Teddy's already on the table, sedated and being prepped for anaesthetic. Let's get into surgery.
Yeah. Okay, team.
In these moments, it's also really important to reassure Teddy. He doesn't know what's going on and he must be scared. What a day, hey? What a day.
Okay, here we are.
Mobile vets Audrey and Alison have been called out to a local kitten shelter to check on a worrying new little arrival.
Hi, Amy.
Amy runs the Kitten Sanctuary, dedicated to saving fragile tiny lives that are otherwise unwanted and abandoned.
Been operating for about over 3 years officially now, specialising in taking in orphan neonatal kittens, which are at the highest rate of euthanasia across pounds and shelters in Australia. So we are one of the very few rescues that do take in kittens this young and hand raise them.
These playful youngsters look right at home, but Amy has grave concerns about a new kitten called Misty.
Hi, Misty. Oh.
Somebody found her on the side of the road and we took her in.
The 5-week-old kitten developed a badly infected toe after fellow orphan Stormy kept trying to suck on it.
Looks very festy, doesn't it? I think we better have a look at that.
Misty is so tiny, she's being kept in a special warm incubator.
All right, well, let's take her out, have a look at that foot.
Amy's desperately hoping the twins will be able to save the tiny kitten's toe.
I might check the rest of her over and then we'll end up at that toe. Just make sure you're growing okay. Now let's have a look at that toe, right? So she's been on broad spectrum antibiotics for about a week.
Since then, her appetite's gone up, weight's gone up, she's been more playful, but the infection just isn't improving on the toe.
And if anything, that's actually looking more swollen and more infected. So I'm worried that that infection's getting worse or possibly spreading.
Just notice she's got a little swelling on this back left leg here.
Yes, she does.
Oh no. Oh, baby. She has been licking and chewing at all her joints after licking, obviously, this infected toe, so she could possibly have passed the infection.
The danger of an infection in a young kitten, especially one that you can't get on top of, is that that infection will spread. It will either spread along the foot or it will go into the bloodstream, and once it's in the bloodstream, it pretty much can be fatal.
Oh, it's so swollen. Oh.
Here we go. Go in here. There we go. Ready? Good boy.
In the UK, Scott's arriving at his Isleworth practice with a special little boy.
Hi, ladies. Let me introduce you to Biggie, obviously, isn't it?
Biggie is a 1-year-old Chihuahua who's a regular visitor to Scott's house.
He's my builder's dog. See, it's quite funny as well because he's covered in tattoos. He likes motorbikes. You know, he's that kind of guy. And then he's got a little tiny little dog. But unfortunately, he's got a bit of an embarrassing problem. He's only got one testicle. So often we see in the veterinary practice these little dogs that have been significantly inbred, or you've had 2 runts of the litter come together to make even more puppies, and they weren't healthy in the first place. And in the case of Biggie, we just need to go and find a testicle which naturally should be outside his body. So I think in this case we're going to have to do a fishing expedition. So sort of like be putting a hole in the abdomen and then trying to hook out the testicle.
Testicles left inside the body where the temperature is higher can lead to mutation and cancer. For Biggie to be cancer-free, both testicles will have to be removed. Maybe not so exciting for Biggie, but a new learning opportunity for vet student Sophie.
You've not seen one before? Oh, okay. You know, ice hole fishing? Yeah, it's like that. It is. So basically, yeah, just make a little hole and then you just go fishing. Instead of pulling out a salmon, you pull out a testicle.
Nice.
All right. Should we put an IV in you? I don't think you need to be a vet to realise that little dogs are more fragile. And all small patients, we take a view they're almost like babies. Okay, sleepy time now, little man.
Suddenly, seconds after being given anaesthetic, Biggie's in trouble.
Just give him a little puff of air, would you?
The little dog's heart rate is dangerously slow.
Come on, mate. Come on, mate.
This family must be distraught, I imagine.
Yeah.
On the Gold Coast, Teddy the Groodle is in grave danger after eating an entire tube of toxic glue.
Bleed, anaesthetic. Okay.
Ready to go to sleep, little man? Good boy.
Alex and Gerardo are extremely worried the dangerous glue is rapidly expanding in Teddy's stomach.
Let's go.
Hey, mate.
Oxygen is on 2.
All right, Teddy. Little sleep, okay? Good boy.
Teddy needs urgent emergency surgery to see if the large mass of glue can be safely removed.
Good boy.
Hopefully when you wake up, you'll fix the problem. Good boy.
Oh, okay.
Oh,
Oh, it's all right. It's all right.
There we go. Now that Teddy's asleep, the time's really ticking. We need to get him into theatre and get this out of the stomach as quickly as we can and wake him up. He's a sick dog, there's a higher anaesthetic risk, and we don't know what damage this glue has already done to his stomach.
Okay. Rosie, you want to take those two, and then Alex, thank you.
No worries.
Okay. Oh, whoa, actually feel there. Just push here.
Ooh, that's the stomach.
That's it there. It's like a rock.
Oh, just be careful you don't cut into that when you go
It's
through.
right under the skin.
My hope now is that we can enter the abdomen fairly easily. It could be tricky because Teddy has had abdominal surgery before.
I'm going to go slow because there could be...
The stomach's just underneath.
Teddy's previous surgery could have left him with internal scars that could complicate the operation.
Okay. Okay, cool.
What are we going to find in there?
Well, the good thing is that the stomach's not stuck to the abdominal wall. That's
One good thing.
the one good thing. Okay. Whoa. I just touched the stomach then and it's rock hard.
God, how much must that have hurt?
It expands, apparently.
As emergency clinicians, everybody knows their role in these high pressure situations. His heart rate's pretty steady. Yeah, it's actually good. You really have to bring your A game. Oh.
Okay.
What do we got?
Feel that.
Oh my God.
It is like a rock.
I can see it under the surface of the stomach.
You can
there.
see it through there? Wow.
Literally through there.
Yeah, we need to open up the abdomen, spleen. Let's have a look what we got here. He's like rock hard.
Have you ever seen anything like this?
No, this would have to be the biggest foreign body I've ever removed.
So getting exposure to the stomach is quite difficult because it sits right underneath Teddy's ribs. So what we're going to try to do now is place some what we call stay sutures, which we'll then use to elevate the stomach. So we want to almost get the stomach out of the abdomen, and then we're going to cut into it, and I'm hoping we can remove it. Yeah, there's a lot of weight there, isn't there?
It is a heavy foreign body.
The last thing we want to do is actually tear through the tissue, trying to get enough elevation.
Okay, let's see if we can pull it out. We got momentum adhered to the stomach from the previous surgery.
The stakes are really high here. We're dealing with a member of someone's family, and we want to be able to call them at the end of this surgery and tell them that it's been a success.
Oh gosh, imagine if it's actually stuck to the wall.
One of the things we're worried about here is when we cut into the stomach, because we can't lift the stomach up very much, we're actually going to get spillage of gastric contents into his abdomen. He's already on antibiotics, but if that happens, we've then got infection that's spread around the rest of his abdomen. We really don't want that to happen, and we really don't need more complications than we already have.
You've got to look at that paw now, okay? I'm worried that that infection's getting worse.
Audrey and Alison have been called to treat orphan kitten Misty, who has a badly infected toe.
She has been licking and chewing at all her joints after licking, obviously, this infected toe, so she could possibly have passed the infection.
The girls are worried that by constantly licking the toe, Misty may have passed infection along her foot and into her bloodstream.
So next steps, little one, we're going to have to find out how bad this infection is. So we'll take an x-ray of the foot, and then from there we'll work out what the next plan is.
The girls are going to do x-rays at a nearby partner practice, which has specialist equipment for such a tiny animal.
So because Misty is so teeny tiny, we're not going to use a normal x-ray machine for her. We're actually going to use a dental machine, because that really takes fine structures like teeth into the image, and so something like Misty's little fingers and toes, that will show up really nicely for us. Okay, so it's not looking good. We can see sort of the bottom half of the toe is there, and then all the bones kind of disintegrate. So it looks like the infection's kind of dissolved away the bone, which isn't great. I'm very, very worried if we leave it there, she could potentially lose her whole foot or her whole leg, so we need to jump in quickly and remove the infected bone. Getting a heart rate?
But suddenly the tiny kitten is in grave danger.
1, 2, 3, 4, 5. 1, 2, 3.
She's not really stable. Her breathing is all over the place. We're having to give her artificial respiration because her oxygen is not quite 100%.
How is he light and then deep? 1, 2, 3. It's always really difficult in little cats because everything's super tiny. So trying to get a tube in is difficult. Trying to get her oxygen levels is difficult. Oh, they're so tiny.
This is it. Okay, I'm going to try and wrap that around.
On the Gold Coast, Alex and Gerardo are desperately trying to save Teddy after the greedy Groodle ate an entire tube of glue.
Spleen out of the way.
It's now expanded and hardened in his stomach. Scarring from previous surgery is making this operation extremely difficult.
Okay, stab incision into stomach.
Depends a bit about what else he's had to eat, you know.
Okay, I have to use my hands. Normally we don't put our hands in stomachs.
Compared to humans, dogs eat all sorts of random things, and we know that Teddy has eaten other things, so we just don't know what we're going to find in his stomach. Yeah,
Okay.
I think we just had no choice this time.
It feels like a rock that's covered in goop and grit.
Gerardo and I have made the incision into the stomach, and you start to be able to smell the contents.
Oh yeah, it's coming now. Holy,
Oh my goodness.
Looks like a cauliflower. Make sure we hold up the...
Yep, I got it. I got it.
You got it?
Yep.
Look at that.
Wow. It's got bits of corn on it.
What is that? It's a potato chip.
It looks disgusting. It's this solid rock, but it's covered with bits of corn and chips and other things that Teddy's eaten. And the smell was overpowering. I could almost taste it. Wow, he must have eaten the whole tube of glue. That's nuts. Inside lining of the stomach looks pretty healthy.
Yeah, no, actually, we're pretty lucky. I think all the mucus kind of kept it off. Thank you for... I could not have done this without you.
Actually, probably could have done, but that's all right. I was glad I was assisting. You can feel the tension ease in the room. It's been a textbook surgery so far. You all right if I tap out then?
Yeah, you go. Thank
I'll
you.
go get Teddy's bed ready for recovery.
Yeah, we shouldn't be too long.
Yeah, okay.
Almost halfway done.
Awesome job, hey?
No, thank you. I'd shake your hands, but your hands are dirty.
All right. That was fascinating to see. He is one really lucky dog. He's going to be quite painful when he wakes up, but all in all, I think we can call that surgery a huge success.
Hello, how are you? I'm Dr. Kate.
At the Bondi Vet Hospital, worried owner Lana has brought in 15-year-old Max because he's stopped eating.
You're an old boy, aren't you, buddy? So he hasn't eaten for 2 days.
Yeah, 2.5.
It's okay, Max. You right, buddy? Not very well. Come on, Maxie. Let's go in. Let's take Maxie in.
I got him when he was 6 weeks old. He's part of my family.
Hi.
He's lost a lot of weight since we saw him last. Do you think he's lost a lot of weight?
I think it's age. He always ate normal. Only last couple of days he had this problem.
When I saw Max on the schedule today and I saw that he hadn't been eating for quite a while, that makes my heart sink. Especially in a 16, 17-year-old dog, not eating for a couple of days, lost 7 kilos in a year. It's a concern. Maxie, it's blind.
I think he's blind.
Yeah, no, he's blind.
Max, I think it's a continuation of what's happened 2 years ago. His body not so good.
See his breathing like this? Right, see how he's struggling to get air in? You can see his abdomen there that's moving. You right? So you hear that cough? So he's got fluid in his chest. It's like kind of having like a wet sponge, and they can't actually fill with oxygen. So what's happening, he would be feeling right now like he would have asthma.
Main thing, do a blood test, full blood test. If something wrong, blood test will show you something wrong.
I think what Lana would like me to say is that we can do all these tests and we can do all of these treatments and that Max is going to get better. And sometimes that is the case. Sometimes that is the case. So there is some point to do a blood test. We can get some clues and we can get some leads about where we actually go to from here. But Max is a very, very elderly dog. 16 to 17 years old is a very old dog. Can I get Max better? I don't know. He's a good boy, isn't he?
In Sydney, Misty's toe surgery is barely underway and the little kitten is in serious trouble.
Good girl. I see 100. That is very, very good.
Finally, the twins get Misty's breathing under control and they can now go ahead with the surgery on her infected toe.
What I'm doing is trying to leave as much of healthy skin as I can attached to the foot so that when I remove the infected bones, there's enough skin to close. What I might do is just leave wide
at the bottom. It's just coming away.
The tiniest toes you've ever seen. We're done.
With the toe surgery over, the girls have given this tiny battler a fighting chance.
We're going to do about 5 of those. All right, we can turn her anaesthetic depth down. So all taken off, sutures are all in. Hello, good morning. I'm going to put you in here where it's nice and warm. Hi Amy, all good. She's in recovery now. Come on through. Missy's recovering really well. We've just got her back in her incubator where it's nice and warm. It was a very big surgery because we removed that necrotic bone or that bone that was infected. That came away really nicely for us and we were able to close up.
I'm so relieved everything went well with the surgery. I knew Missy was in the best hands with Audrey and Alison.
You can show Mama your boxer gloves. Hi, baby. Okay. Yeah, she's recovering so well. So she's going to be a little bit groggy for the rest of today, but as soon as she's up and swallowing properly, I think give her a bottle. Okay. And I want you to continue on with those antibiotics. Oh, you're looking for your bottle. We better get you home so you can have some milk, all right?
Teddy.
Back on the Gold Coast,
Teddy, good man.
Teddy is finally awake after life-saving surgery to remove a massive lump of hardened glue from his stomach.
You standing already? Such a brave man.
Teddy has recovered from surgery.
Oh, stay still.
His belly is a bit sore, but that's to be expected. The team are going to keep a close eye on him and make sure that he is comfortable. Overall, this is a great outcome.
You're wobbly, hey? You still got a bit more time recovering, hey? Hey, you're a very brave soul. But you got it all out. The team's gonna take care of you, so it could be a good way.
Here we are.
In Sydney, Audrey is coming to check up on Camilla, who's waiting with her owner, Jordan.
I've had Camilla since December last year. She's very quirky, very needy, but she's like my best friend. She is my best friend.
Hi, Jordan. Hi, Camilla.
I noticed Camilla was unwell a couple of days ago because I noticed she just wasn't being herself. She was a little bit lethargic, not active, and was turned off her food, which is really unlike her.
How's she going today?
She's been better.
So Camilla is an 8-month-old French bulldog. I've seen her yesterday and we're worried because there's some discharge coming out of her vulva.
Audrey wants to do a test on Camilla's urine to see if the little dog has a urinary tract infection or if it's something far more serious in her uterus.
You want to say goodbye to Mama? Bye, Camilla. Milla, I love you. I love you.
I do want this day to be over with and just want her home, healthy, happy, and just back to her normal self. Yeah.
All right, let's go. Come on. Which way?
Minutes later, the test confirms Audrey's worst fears. Camilla's infection isn't in her urinary tract. She has a much deeper and potentially fatal infection in her uterus.
Just as we thought.
So uterus infection is called pyometra and it's quite serious in a dog, especially a dog as young as Camilla. It's when the uterus fills up with pus and becomes infected, and potentially that pus or infection could spread into the bloodstream. If we don't go in today, she could die.
All right, honey. Let's go.
The news is devastating for Jordan.
Camilla means more than anyone knows.
Let's give you your anaesthetic now, boy. Okay, sleepy time now, little man.
Come on, baby.
At his Isleworth clinic, Scott is alarmed that Chihuahua Biggie has suddenly stopped breathing.
Have a breath.
Scott needs to perform a testicle removal, but the little dog isn't responding well to the anaesthetic.
His heart's slowing. Come on, mate. This is incredibly frightening. I'm listening so intently, but I can hear that the heartbeat is just getting fainter and fainter. Jem, can you just get a little bit of adrenaline? Just keep breathing for him. Quick, Jem, that's fine. Come on, mate. Just keep breathing, 1 every 2. Keep breathing for him. Those waves are looking a bit more regular now. Bloody hell, this job honestly makes you go grey.
I think I just aged 10 years.
Yeah. And what's even worse is the stress of when it's someone's dog that you know.
Yeah.
It somehow makes it worse. He was having a little look at the Rainbow Bridge there. I think he saw a squirrel on the other side. So that's the danger of anaesthetics. You know, we deal every day with life and death, and our job is beyond serious, you know. And you can laugh about, you know, a little dog called Biggie with 1 testicle, but, you know, it's a much loved member of the family, and, you know, when things like this happen, it just reminds you just how important life is, and how important our job is. Just keep breathing, just keep breathing. That's for you guys and the dog.
With Biggie finally breathing normally, Scott can start trying to locate the missing testicle.
So this is going to be speedy ice fishing. This is not ice fishing for pleasure. This is for a specific purpose of catching the infamous testicle fish. It's very likely that it'll be a lot smaller than the other one. Lots of reasons why it's difficult to find. But I've just found it. So look at that. There you go. So you can see immediately that's 1 testicle and that's another. So
Dogs are in danger of cancer if testicles remain inside the body. So Biggie will now have to have both testicles removed.
There you have it. 1 naughty testicle. Okay. So Biggie, and Smalley. Biggie can now look forward to a long and healthy future. Now that we know that that testicle that was hiding away in his abdomen is out, there's no chance that he can develop cancer as a result. And hopefully, I'll never, ever, ever have to anaesthetize Biggie ever again. I'm so relieved to have the ability to wake this dog up. You know, you just be able to hear him breathing and hear the beeping and know that he's okay is a massive relief.
You're right, buddy.
Hi. Hi. Wow, what a relief. I just think when Biggie's heart nearly stopped in there, honestly, mine did too. To think that that little life that was in my hands was slipping away, like, honestly, Biggie, what are you trying to do to me? Oh, come on. That's it.
Biggie will have a sleep before being reunited with owner Stu.
Oh, you look so cute.
You right? So you hear that cough? So he's got fluid in his chest.
In Bondi, Kate is starting to have grave concerns about elderly dog Max. She's doing urgent blood tests to find out why he's not eating and is struggling to breathe.
There you go, buddy. So what I'm going to do is run some in-house bloods. They're going to be back within the next sort of hour or so.
Just help him, please. Moose. Moose.
Devoted owner Lana can't imagine life without her special boy.
I want him to live much longer because he's a pleasure.
Next, Kate is doing an X-ray to see what's going on with Max's breathing.
With Max's lungs is that there's not much black in here. So all we can see is that there's a whole bunch of fluid that exists in this chest cavity. This all here is lung field, and this is supposed to be black, and it's not. I have a sneaking suspicion that this is actually probably coming from his right side of his heart. In other words, his right side of his heart's possibly collapsed and failing.
If I can help, I help because I'm against just do a job and next dog. Sorry, that's part of my family.
Lana is now desperately hoping Max's blood results are good.
So what we can see here is we're starting to get into multi-organ dysfunction. We've got high kidney enzymes. In fact, one of his kidney enzymes is so high that it's actually unable to read on this machine. I'm really devastated about these blood results. I can't give Max new kidneys. I can't give Max a new liver. A lot of these problems, I can't make his bone marrow produce more red blood cells. So this may be the end for Max.
All right, let's go. Come on.
In Sydney, Audrey is on her way to hospital with French Bulldog Camilla, who has a uterus infection called pyometra. She needs urgent desexing.
Pyometra is a serious disease that can happen if you don't desex your dog. It can happen every time they come on heat. The uterus can become infected, and it's very, very serious, especially in young puppies.
Okay, let's take some bloods. What's happening back there? Nothing. Nothing to see here. All right. That's it. Okay. Good girl.
Audrey wants to reassure Camilla's owner Jordan, who's beside herself with worry about her little girl.
Hi Jordan, it's Audrey from Aussie Mobile Vet.
Hey Audrey.
Everything's going well, so we've taken some bloods, I've popped her onto fluids, and we're just starting her antibiotics now. Going quite well. Now the blood results are actually pretty good. So her white blood cells are normal. She's a little bit anemic, but that's not unexpected with some infection, and also she's been on heat recently. Her liver and kidney function is great. So I think the anaesthetic should go well, and I think that we've caught it pretty early. So I'll give you a call when we're done.
Okay.
Okay.
All right, cool.
Camilla is a French Bulldog, and aside from the fact that she really needs the surgery because of the infection, her anaesthetic alone is going to be quite risky. French bulldogs have a squished in nose, and that makes them difficult to intubate for the anaesthetic, but also we have to be careful with the type of drugs we give them. All right, stingy one's coming up. Okay. Okay. Oh, I'm sorry, that one stings so bad, I know. Stress fart, that's okay, happens.
Sorry, I know
With Camilla safely sedated, Audrey can now start the urgent surgery to remove the infected uterus.
So I'm starting the incision and I'm expecting to find a big uterus in there. Maybe full of pus, maybe full of a little bit of pus. If it's early, that would be great because it means we got it in time. It is quite inflamed. There's a lot of blood vessels going around that uterus. You never really know what you're going to see when you open up, so you've got to be prepared and prep for everything. That uterus is looking a lot larger and inflamed compared to what it should look like. The inside of that does feel like it's got some thick pus in it. So we're going to have to be quite careful today, just making sure when we remove it, none of the infection goes into the abdominal cavity. That infection can spread to their bloodstream and they can potentially die from it as well. Poor females always get the shortest straw. So I've tied everything off, and so it's the final step. We're going to cut the cervix or uterus out of the body. So just in the nick of time. Okay, so that's the last stitch done. It's going to heal really nicely, so we can wake her up and bring her home to mum. Wakey. I'm really happy with how Camilla's surgery went today. Everything came away really nicely. We got it in time and early. Good girl. Can you take you home to mama? Oh no. Come on. I think Jordan's going to be so excited and happy to have Camilla back. She's been really, really worried, and this is the best part of my job.
I can't give Max new kidneys. I can't give Max a new liver.
In Bondi, Kate is devastated that Max's blood results are so grim.
A lot of these problems, I can't make his bone marrow produce more red blood cells.
Lana has had her beloved Max since he was a pup, and every moment separated from him is heartbreaking.
You right, Maxie? He's just having a little sleep.
Kate now has to gently explain to Lana how much Max's health is deteriorating.
Max is a very, very sick dog. He's 100% suffering. And I'm not entirely sure right now that Lana knows how sick Max is. I'm really sorry. He's not going to come back from this. Honestly, I don't even know that he's going to make it the night. Like, he's just deteriorated today to a point like all he wants to do is sleep. One of the very difficult things about being a vet is to bring up the idea of potentially putting the dog to sleep. It's a very difficult conversation to have. And honestly, I feel as though that the duty that I have is to relieve suffering. And I try and see this in the most positive light as I possibly can see this, is to relieve suffering. And I hope I can do that job well. For Max.
Later that day, Max's brave battle ended peacefully with Lana by his side. In Sydney,
Look who's here!
Jordan can't wait to be reunited with her beloved Camilla. Audrey had to perform life-saving surgery to remove the little dog's badly infected uterus.
It couldn't have gone any better. We got there just in the nick of time. So she should recover well. So antibiotics in her fluid line today, and also antibiotics to go home with. Okay. So Camilla's case really highlights the importance of desexing your pet.
as well as the behavioural problems and the unwanted pregnancy. For us, it's the medical issues, infection, breast cancer, those kind of things are really important, and we are starting to see it a lot more as people are delaying desexing or stopping desexing altogether.
I know, you're ready for bed. Thank you, Audrey.
Da, 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 da. There he is. Come on, let's go see Daddy. Come on. Oh, there, little tyke.
In Isleworth, builder Stu has arrived to pick up Biggie the Chihuahua and to hear about the little dog's traumatic testicle removal surgery.
So I've come to pick up my little boy after having been castrated, and yeah, hopefully it's all gone all right.
Hello, mate.
Oh, hi. Oh, hello, little man. Oh, look at your silly little cone.
There he is.
Is he all right?
Yes, he is now. The surgery went absolutely fine, but yeah, he did give us a massive scare because he decided,
Oh, really?
Yeah. When we first anaesthetised him, he stopped breathing, which a lot of the time...
Jesus.
Yeah. A lot of the time they do stop breathing initially and then they come right. But he just stayed not breathing. And then his heart started to slow. So we had to give him adrenaline and fluids.
I'm gonna cry.
Yeah.
Jesus.
My nurse, who is a trainee vet, I think she's thinking twice about a career. Maybe she'll come into building trade.
Yeah, to be fair, I could do a hand on a sleeper wall.
Yeah, sure. Okay, yeah.
Genuinely, it's great to be able to have a bit of a laugh with Stu and to put a smile back on his face, because I can see just how shocked he was. The fact that Biggie was so close to death. But look, these two are such great mates, and it's just so great to be able to hand this dog back in one piece. Well, without his crown jewels, of course.
Thanks a lot, and I'll catch you soon.
Bye, bud.
Cheers, mate.
Bye, lads.
Oh, little man. Come on, you.
Bye.
He's dirty.
2 weeks later, Biggie the Chihuahua is back on the worksite with owner Stu after Scott successfully removed both his testicles.
You're gonna fight to survive, aren't you?
As for little kitten Misty, she's making a good recovery after her toe surgery.
So all the stitches are intact. That's healing really nicely. There's no swelling or discharge. Her other toes look great.
And hopefully she'll soon be well enough to go to a loving new home.
So I'm super happy with how it's healing. I think we got it just in the nick of time.
You know I love you too. You know.